Public concern is high, but the public understanding of the actual issue is low. Incarceration alone will not solve the complex issue. Our community has limited resources, and persons living with substance use disorder have a direct impact on public and private resources. The opioid epidemic continues to overwhelm our community, putting citizens and public safety at risk. Substance use and ignorance of what is occurring in our community will not be solved by itself. Opioid-related emergencies continue to occur in our area. Both field response personnel and correctional staff directly deal with opioid-related matters daily. The mission and goal of the Sheriff's Office is to educate staff and our citizens on what is occurring in our community. We also need to develop realistic solutions on how to handle the opioid epidemic by working directly with people at risk of opioid overdose and living with an opioid use disorder by providing deflection efforts to our community members and supporting reentry programs to those who are returning to our community from an incarcerated setting. Not addressing the opioid epidemic in our community will likely result in poor health outcomes and even premature death. It is our duty and responsibility to provide public safety to all so that everyone can have an opportunity to live a productive life. We need to protect everyone, especially when substance use impairs the person's ability to make good decisions. As a community, we can do better and help those in need.
The American Society of Addiction Medicine defines addiction as a treatable, chronic medical disease involving complex interactions among brain circuits, genetics, the environment, and an individual's life experiences. People living with a substance use disorder use substances or engage in behaviors that often become compulsive and continue despite harmful consequences. The Diagnostic and Statistical Manual of Mental Disorders recognizes a problematic pattern of substance use that leads to impairment of functioning, with at least 2 of 11 symptoms occurring within the past 12-month period. Some of these symptoms include an inability to consistently abstain, cravings, increased tolerance, dysfunctional emotional responses, impairment in behavioral control, and diminished awareness of behavior and relationship problems. Like other chronic diseases, substance use disorders can involve cycles of relapse and remission. The severity of a substance use disorder can be described by how many symptoms an individual has in relation to their dependence. For example, spending a significant amount of time or effort obtaining the substance, continuing to use the substance despite having repeated social and interpersonal problems, and fighting withdrawal symptoms that affect their physical and mental health. Substance use disorders are progressive and can result in disability or premature death. Substance use disorders, often referred to as alcohol or drug addiction, are not a choice, and it is not due to a lack of willpower or moral failure. Addiction is a chronic brain disease that can be comparable to other chronic diseases like diabetes, heart disease, and high blood pressure. In the case of substance use disorders, the organ impacted is the brain. With an evidence-based and personalized treatment plan, outcomes are similar to treatment outcomes of other chronic diseases. For those familiar or living with chronic disease, you may already know that vaccines cannot prevent these conditions, and they do not just go away by themselves. However, it is possible to manage a chronic disease with appropriate treatment, which can often include medication and lifestyle changes. Many chronic diseases can be managed in such a way that their symptoms do not impact a person's health and functioning. This is true for substance use disorders.
The Sheriff's Office continues to locate resources and funding to support staff and program efforts. Some funding successes have been budgeting funds to hire a behavioral health and substance abuse counselor who works directly with our incarcerated population. We have expanded the coordinator's role to be more involved with treatment court and the other needs that the judicial system deems necessary. This is still a work in progress, and we have seen noticeable success. Most recently, the jail received a grant to offset the cost of providing more resources and services to incarcerated persons. We are now able to dedicate resources and personnel to people impacted by the opioid epidemic and other behavioral health concerns we are seeing in the jail population. The funding has also allowed us to be more involved with our community by providing proactive police work through deflection efforts and education to our community partners, citizens, and other stakeholders.
Originally, addiction had largely been viewed as a moral failing or unwillingness to use self-control. Today, this stigma continues to persist and influence how people view others living with a substance use disorder and how often those living with a substance use disorder view themselves. Self-stigma can often be a barrier to people getting treatment because many people believe they should be able to stop using on their own, or they carry shame and guilt that holds them back from asking for help. Stigma and a lack of understanding have, at times, caused individuals who are impacted by a substance use disorder to be isolated and rejected. This has even been known to influence the quality and standard of care provided to people who need medical care due to their substance use. All too often, those seeking medical care have reported being met with indifference and apathy by medical providers.
Having a proactive approach instead of a reactive response sets us up for success. We have already shown success with all of us working together for a common goal. What we had been doing in the past was not working. We need to change our approach with new ideas and have an approach that is future-oriented instead of thinking incarceration is going to solve the problem our community faces. We don't always need to agree, but establishing a common goal and a mission is necessary. I have noticed a change with the stakeholders, and there seems to be more effort now to make a difference. I am hopeful that with the efforts that we are working towards makes a difference. I also would hope that the community also takes the opportunity to get involved in trying to solve these issues. The Sheriff's Office alone can't do this. It needs to be a community effort, and we need to work together to have a good outcome.